On Nova Scotia PRA route to practice medicine in Canada part 2. If you've not watched part 1, please go and watch it because that's where it started. I want to be breaking it down so that you don't take long sitting down to watch the video. By the way, if you're coming across my channel for the first time, please subscribe, share, like. That's the way you can encourage me because it takes time to do these findings and bring them together. If you watch as I'm talking, I'm always looking at my laptop where I detailed how I'm going to explain it for you to understand it. So please encourage me by sharing these videos to your WhatsApp platforms for medical students, your Telegram groups, so that others can actually leverage this and also join you. If you want to succeed, make sure you are lifting others behind you, because when you get to the top is usually lonely if you don't have people cheering you up there. So that brings me to the fourth point. 1, 2, 3 are in the previous video. Go and watch it. This is the fourth point. The fourth point for you to meet, for you to practice medicine in Nova Scotia as a medical officer, general practitioner, family physician. These are the ones I'm taking now. There is also the specialist route. I'm going to do a different video for that. But for as a medical officer, as a family physician, or as a general practitioner, I have done the first 3 steps. This is the fourth step. The fourth step is this: meet the recency or currency requirement. So you need at least 450 hours of relevant clinical practice during the 5 years before starting your Nova Scotia process. So for the primary care route, which all of us know what is primary care, your clinic practice, if you're working in a primary health care center, all those your office hours, office practice, clinic, ward round, all those things, they are included in your the office practice. Then you will understand that this 450 hours is easy to get. If you go to work at 8 a.m., you work 8 to 4 p.m. That's 8 hours. 8 hours times 5 in the week, Monday to Friday. Let's say you don't do call, that's already 40 hours. 40 hours times 4 weeks, that's 160 hours. 160 hours times 3 months, that's 480 hours. And they just need 450 hours. So if it's something you really want to achieve, that you put your mind to do it, you can actually do it. Even if you don't have it now, you can go and do your practice. And for those of us in Canada already who have missed out this recency of practice, it's something you can actually say, okay, let me give it time and travel back and do this recency of practice and come and do your application. If you still want to practice medicine, there are some people who have decided, I have no business with medicine again, and that's okay. That's very okay as well. So for those that want to practice medicine, this is how to get this your recent 450 hours wherever you are, whether you are in UK, because I've had somebody that reached out to me and said she's been in the UK for like 2 years, she has not been practicing. Does she qualify for this route? And I said, in the last 5 years, that's what they said. But for this recency, I will always advise anybody, please have it a recent thing. At least in the last 1 year, let it be that you have these 450 hours of practice. And it's something you can easily get in 3 months. That's the fourth criteria. Then the fifth criteria is meet the eligible English language requirement. But there is an exemption in this, which is what's assessed based on individuals and the qualifications that you present. So in certain circumstances, including passing a accepted Canadian technical examination, this English language test can be waived for you. Or having a recent qualifying postgraduate education conducted in Canada can also give you a waiver for this. But if you don't have anything that can give you a waiver for this, they take OET B, they take IELTS academic 7 across board, and they take CELPIP general, which is 9 across board. There is a recent announcement that from January 1, 2027, they will stop taking CELPIP general and IELTS academics. So people will be left with just OET medicine B, and that's just it. So by next year, we're already I'm doing this video in August. So by next year, January 1, they will stop taking IELTS academics and they will stop taking a CELPIP general. So do with this information what you want, but this is what is on the website that they will stop considering it. But if you have a result that has happened before January 1, 2027, they will still take it. So it means if you do IELTS today or do IELTS in December, before that January 1, they can still take it to process your stuff for next year application. But after January 1, they will stop taking it. That's exactly what this means. I hope I have explained it in a way you will understand. If you don't, please drop the comment and I will respond. I respond to comment. If you go through my comment, you see I respond to comments. Then 6 is what? Create or use your Physician Apply account and source verify your credentials. This is the 6th step. Your medical degree, postgraduate training, applicable specialty recognition documents need to be verified through Physicians Apply. This is simply different from submitting your license application. It's totally different. You have to verify even your house job. Like my house job, I had to submit, those things we fill, you sign out when you do your rotation. O&G, those forms you sign that the head of department signs, senior registrar sign. I had to submit it to verify it. So these are things you can also verify. Then if you have done rotation as a medical officer in any facility, because some facilities don't do psychiatric posting and you go to a psychiatric hospital and do a posting, you can also get a document from them that you can source verify, because when you upload it to Physicians Apply, they will have to contact that facility where you did it and verify it. That's what it means. That's what this source verification means, that whatever you are providing, can we verify it? So make sure that whatever you're providing is what? Verifiable. That's one. Then this when you hear me say pace, I've already said it in the first video that you're going to be hearing pace. It's just like a body that is assessing your credentials and your practice to practice medicine in Nova Scotia. So when you have done this source verification and everything, the catch here in Nova Scotia practice is this: PACE application is not round the year. So you have to watch out for PACE application opening and submit the preliminary application. So this is particularly important. An important Nova Scotia step. That's the way I will put it, because you do not simply send a PRA application to the college whenever you want. That's how to explain it then. But when PACE opens up application period, so during this opening, you submit your application. Then PACE will now screen applications and identify who can proceed to the next step. And that next step is what? Step 8, where you complete the college review of qualifications when invited. So if PACE moves your application forward, the College of Physicians and Surgeons of Nova Scotia instructs you to submit an application for medical registration through Physicians Apply, so that a registration agent can review your documents. And you see why what I'm saying in 6 is important about creating your document, your account with Physicians Apply and verifying them. Because at this stage, if you say you have not verified your document, PACE is not ready to be waiting for you to give them access to your verified documents. They will simply move on with those that are available, because document verification takes time. I remember when I sent mine to verify, I finished from University of Benin. And when I sent it, it was not forthcoming. They were able to reach out to me. I was not in a hurry. So when they reached out to me, I was able to reach out to them to say, okay, I sent this. I've not gotten any verification about it. And they responded back. So imagine if I was under pressure. Will I be having time to do that back and forth? That's the reason why I said verify your documents. Let them be ready in Physicians Apply. When you get to this stage where PACE moves forward with your application, you can just give them access to your Physicians Apply. They will now see all your documents that has been verified. And when you go through PACE selection, you meet the minimum requirements, and this does not also guarantee a PRA position. That's one thing I want you to know. PACE ranks applicants using factors including currency of practice, which is why I say you should get your recency, relevance of your rotations, standardized examination performance, Canadian healthcare experience for those who are already in Canada that have some level of Canadian healthcare experience, and continuing professional development. Do you have a master's? Are there other things you're doing? Do you have a PhD? These are things that can actually give you an upper hand with another person. The most competitive applicant proceeds to an interview with Nova Scotia Health. Once you get to this interview stage, trust me, you have actually beating most people. And that takes me to what? The third video.